So I think we'll just give it another minute before we go ahead and get started. It's now 11 o'clock, so. I guess we're live, y'all. We'll go ahead and get started. Hello, everyone, and welcome to the Cancer and COVID-19 Protecting Our Health from the Harms of Commercial Tobacco webinar. My name is Chris Johnson. My family and I are Dakota from the Sisseton Wahpeton Dakota. I'm the Prevention and Policy Manager at the American Indian Cancer Foundation. AICAF remains dedicated to our mission of eliminating the cancer burdens Indigenous people face while maintaining our commitment to reducing the spread of the coronavirus. Today's webinar is a part of a series of chats with leading experts across Indian country where we address Indigenous health issues related to cancer and COVID-19. We want to thank each and every one of you for taking time out of your day today to join on this conversation. We hope to leave a room for questions at the end of the discussion, so please submit those questions in the chat box or the comment box on Facebook Live if you are there. We'll be sure to address those, and if we're unable to, due to time, we'll follow up with everyone. So today we're joined by Rae O'Leary from the Missouri Breaks Research Industries, Inc., and Joshua Hudson from the National Native Network. And so we just want to share some quick introductions for our two speakers today. So Rae O'Leary conducts research and leads public health initiatives for Missouri Breaks in Eagle Butte, South Dakota on the Cheyenne River Sioux Reservation. Rae has led the Chun-Li Coalition for the past 10 years, and it was her leadership that influenced the Cheyenne River Sioux Tribe Tribal Council to pass one of the strongest smoke-free air policies in Indian country. She has also had the opportunity to testify to the United States Congress on the youth e-cigarette epidemic and Juul's attempts to target Native people. Joshua Hudson is a citizen of the Bay Mills Indian community and currently lives on the shores of Lake Superior in northern Michigan. Joshua's work has centered on health, recovery, and healing intergenerational trauma. He currently serves as the project director for the National Native Network at the Intertribal Council of Michigan, working to develop, cultivate, and disseminate commercial tobacco and cancer resources for training for tribes and tribal organization. He also currently serves as the tribal judge for Bay Mills Indian community for both Healing to Wellness Court and the Court of Appeals. Additionally, Joshua is currently a fellow of the W.K. Kellogg Foundation's Community Leadership Network, which is an innovative fellowship for local leaders to connect, grow, and lead transformational change on behalf of children, families, and communities. So I want to thank the both of you for your generosity of time to join in this important discussion today about what's currently going on in the world and how our Indigenous communities can come together to support one another during the COVID-19 pandemic. And so before we begin, we want to know where everyone is joining us from today. So please answer the poll if you're on the Zoom, or else if you're on the Facebook live streaming option, you can answer in the comment section. So it appears a lot of folks from the Midwest and the Northwest, East Coast and the Southwest. And so with that, I'd like to welcome Rae and Josh today.
Thanks, Chris.
Thanks, Chris.
And so as we get right into it, we know that COVID-19 is a respiratory infection, so it's never been more important to have strong lungs than it is today. Any form of pollution in your lungs isn't great, but commercial tobacco smoke is particularly unique because it contains over 7,000 chemicals, including 250 known to harm humans. Smoking and vaping involve touching one's face repeatedly, so it's also difficult or impossible to smoke or vape in a mask. Hookah and water pipe users often share those mouthpieces, which we know is not in line with the CDC recommendations to avoid touching your face. So with all of that information in mind, how can we encourage and support those who want to quit using commercial tobacco during the COVID-19 pandemic?
Great points. You want to go first, Josh?
Sure. So what I always kind of like to lay the baseline down is we just have to remember that we need to approach all of our friends and relatives who smoke with empathy and kindness. generally, but also during the time of a global pandemic. It's a very stressful time for everybody. So just making sure that, we just let them know that we care about them and really focus on highlighting that we want to help minimize the risks that they face, both as a smoker, but also when they go out to get their cigarettes or their cigars or their cigarillos or whatever commercial tobacco product they're using, because they will always need a constant supplies. That's why these industries exist today. So just really highlighting that they're putting themselves at risk, and that, as someone who cares about them, that we want to help them mitigate that risk and decrease that risk for them. But really just like having a conversation and not lecturing people on what smoking does to lungs and their whole body, and how that's not safe. And really highlight that there's no safe way to smoke around others right now during the time of a respiratory pandemic.
Yeah, so I agree with everything you said, Josh. I think as a former respiratory therapist, I kind of get into the physiology of like how smoking and COVID impacts the lungs. So for me, I like to, if I can understand why there's that connection and how it's going to have an impact, it would help me to be more motivated to quit. So I think the main things are when you are a smoker, the cilia in your lungs are damaged and burned. And cilia are like these tiny hair-like structures that are inside the lungs that are inside the air tubes, and they constantly pulse upwards towards your mouth. And that's basically what helps the mucus come out of the lungs. But if you are a smoker and your cilia are permanently damaged, or not permanently, but temporarily damaged because of the what you're inhaling, it's going to be a lot harder to recover from COVID because the cilia can't get the mucus out, and you're going to be at risk for pneumonia and all the other complications that come with COVID. I think the other thing to point out to smokers is that smoking, just the act of being a commercial tobacco user, impacts their immune system. So they're not going to be as strong if they do come down with COVID to be able to fight that and recover in a good way. So just kind of pointing out the anatomy and how that works with smoking, I think is important. But I totally agree, Josh. I think that anytime we can approach people with, love and support rather than shame and guilt over an addiction, we're going to have better conversations. The communication will be more open, and ultimately they'll have better success in thinking about quitting. And sometimes that's just where it starts. Maybe they're not ready to quit today, but to have that conversation and just getting them thinking about it is a step in the right direction. And also, I would say that if you're a believer of traditional healers, I think there's a lot of value that I've seen in the role traditional healers can play in helping people quit smoking, but also the more Western medicine, which is state quit lines, have great coaching services and can get people connected with medications and nicotine replacement therapy to support them in their journey to quitting.
So you guys kind of already got into this question, but if you guys like to add on to some of this, what tips do you have for someone who might be considering quitting using commercial tobacco right now?
Go for it, Rae.
Okay. I think the main thing that I tell people when they're working on quitting is to plan for setbacks. It's not an easy process to quit smoking. So I think that, or vaping or chewing or any form of commercial tobacco. So I think that if a person can think ahead to what the potential triggers are for them to start smoking again, and plan for that and have a list of things that they can do when they have that trigger, people that they can call, people that they've have some accountability with. Maybe they're doing it with a friend and they can call a friend and say, look, I'm struggling, I really want to smoke or vape right now, that can get them through that. So expect setbacks, they're going to happen more than likely, but be prepared for them so you can get through them easier. Another thing that I've seen be really helpful is for people to make a list of the reasons that they want to quit smoking. Maybe that's their kids. Maybe it's COVID right now. Maybe it's, they just want to be more healthy in general. But if they can make a list of their reasons and keep that very visible, keep it, we're all stuck at home right now, so you don't have to carry it in your purse necessarily, but post it on the fridge, on your bathroom mirror, as a constant reminder of your reason for quitting.
Yeah. Everything I have to say goes along with that too. One thing that I like to tell people about is smokefree.gov. So it's a website that you can go to and you can actually build your own quit plan, where you'll be able to identify triggers. You'll be able to identify what areas you think will be the hardest for you. Because if you ask a smoker, what's the one cigarette you couldn't give up? And for some people, it's the first cigarette in the morning. For some people, it's a cigarette after a meal. And so on smokefree.gov, you can build your own quit plan and you can identify those key areas. And they'll also have some tips or some tricks or some resources that you can pull in. And so, for instance, for some people, they like to smoke when they drive. And so there's a suggestion, which I mean, most of us aren't doing a lot of driving right now, but like that's just an example. And so they suggest like leaving some cut straws in your car. And so you could hold it, and then if you like breathe through it, right? And so clearly it's not a cigarette, but it's helping manage some of the things that we're really wanting. So I just think that that's a great resource and it's free. So smokefree.gov. But also I would say call your local pharmacy and see if you could get help accessing nicotine replacement therapy at little or no cost to you, because some insurances cover it. Sometimes there's programs that are available that will cover the cost or partially cover the cost of nicotine replacement therapy. But always when you're out getting your supplies, you could always just swing by near the pharmacy aisle or near the medications aisle and pick up a pack of NRT, so like gum or patches, if you wanted to try it out on your own too. But just be careful, like if you're purchasing them over the counter and you haven't consulted anybody, because there is the possibility to get patches that are just a little too strong potentially for you, or they might not be strong enough. So there's resources available. Also, there's quit lines. So there's all kinds of resources available to you right now that aren't really going anywhere.
I'd also add to kind of piggyback on that, Josh, it's a great idea to reference the pharmacies. I know locally here on the Cheyenne River Reservation, our pharmacist at the Indian Health Service, or the Cheyenne River Service Unit, recently got nicotine replacement therapy, or NRT, added to their formulary as an over-the-counter medication. It is an over-the-counter medication in other pharmacies, so there's no reason that it can't be for IHS. So if that's not a step that the IHS or Urban Indian Health, where you're located at, has taken, for those that are working in public health, it might be a good question to pose to the pharmacist to see if that's a possibility. And that makes it much more available, because then they don't have to see a provider at all to get that. They can just get it directly from the pharmacist and get their consultation and dose, appropriate with the pharmacist who's qualified to make those recommendations.
Okay, thank you. You guys are too good at this. You kind of got into the next question as well. So a couple of our previous webinars ago, we talked about the immune system's response to stress and the need to really take care of ourselves, and especially our mental health during these unprecedented times. So, a lot of people are under stress right now, just, of the unknown with COVID-19. And so some commercial tobacco users also state that having a cigarette or other forms of nicotine really allows them to feel less anxious and kind of decreases that stress for the time being. What would you say to those individuals who are experiencing, a lot of stress right now during the pandemic and still trying to abstain from using commercial tobacco?
Oh,
go ahead.
For it. So what I would say is, like, this is a really stressful time. So what I always like to highlight to all my friends and all my family is, like, any feelings that you're having are really valid, because it is really, really stressful. But I'd also just like to point out that there's many, many ways that are at our disposal, even in the time of physical and social distancing. to relax and to help calm down. And I'm sure Rae will get into this, but smoking actually increases our physiological responses that mimic anxiety, things like raising your blood pressure and increasing your heart rate. And so in the sense that it's not actually relieving your anxiety, you're really just feeding, like it's a stimulation that's feeding an addiction. And that's outweighing the physical effects that are actually happening. So it's not actually decreasing your stress. In some ways, it's increasing your stress. It's just that you feel good because you're getting the little bit of reward center. And I'm not a doctor. I'm not a psychologist, but I think this is just some basic level stuff around nicotine addiction. But so circling back, there are just many options available to us right now. There's guided relaxation techniques, guided meditation techniques. You don't even have to go to YouTube or download an app. You could just set a 2-minute timer on your phone and breathe in for 4 seconds and breathe out for 4 seconds for 2 minutes. And that will decrease your sense of stress within your body. And if you don't believe me, you could totally try it. But also like exercise is a great stress reliever. And it also just generally improves your body functioning on the whole level, and it can be any impact. And I know that most people are like, well, gyms are closed right now. Gyms are closed right now, but you don't have to go to a gym to exercise. There's plenty of sidewalks and roads to walk on. You could go running if you wanted to, or it could just be as simple as doing some yard work, because that's exercise. Exercise doesn't always have to be the only thing you're doing. You can get exercise while accomplishing other tasks, like doing spring or summer cleaning, for instance.
Yeah, that's a really good explanation of the reward center and how that all works. And I think also pointing out that the reward is temporary, that, they feel better instantly as soon as they get that hit of nicotine. But as soon as that nicotine is gone, the brain's telling them they want more and more and more. And that's how addiction gets started and perpetuates into something bigger than they ever imagined it would be. So I think just having the medical explanation is helpful somewhat, but I think too, just acknowledging, like Josh said, to validate their feelings and have that conversation with them and encourage them to quit. But if it's just not the time because of the stress, accept that and say, maybe it's not the time. There's other things that they can do to help protect themselves and their family during this time, such as not smoking in their home. Maybe they're not ready to quit altogether. Maybe they just want to cut back. But if they continue to smoke during this time, it's very important for the health of the other people in the household that they are smoking outside the home, outside the vehicle, because of all those secondhand effects. Anything that compromises the immune system and hurts the cilia and the physiology and makes you more at risk, I guess, for COVID complications also applies to bystanders or family members that are in the household. It's not just the firsthand effects that hurt the smoker, it's everybody else in the room. So encouraging them to take it outside. It's great weather right now. It's a good chance to get outside and maybe establish new habits in their homes as well that they can keep moving forward. Also, if they do continue to smoke, I know, Chris, you mentioned earlier that it's impossible to use masks correctly when you're smoking if you're out in public. I've seen people, with the mask down under their neck smoking, and you might as well not bother at that point. But I think other precautions such as washing their hands before they smoke and again after they smoke can help reduce the possibility of spreading the virus from that hand-to-mouth habit. And then, of course, just don't share. If they're using hookah, if they're using a vape pen, if they're using a cigarette, make sure that they're not sharing that with friends. It's just simple infection control. If they're not able to quit, take these extra steps to protect themselves and the other people they are potentially exposing.
That's a super good point about all of that, because we know folks are still going to use commercial tobacco. So be safe about it when they do. And so I guess the next question that we have is, how have both of your organizations modified your work to really address the current community needs around tobacco during COVID-19? So things like, how can we get more folks these services while physically distancing, if that's more like the quit lines with, different phone calls and texting or FaceTime options, or if you're, if they do things like mailing out those NRTs or anything like that, just a question for your organization. And I don't know if the both of you do direct cessation work, but maybe how you've seen other folks really address that too, I guess would be helpful to know.
I think we're on a pattern of taking turns going first, so I'll take this one. So what we've done here at Missouri Breaks, so to kind of back up, Missouri Breaks is the organization I work for, but we lead the Chunli Coalition, which is our local tobacco coalition here. So we do a lot of tobacco education. And one thing that we did recently, we made a handout. It's just a one-pager on fighting COVID-19 by quitting smoking or vaping. It kind of goes through why it's important to not smoke if you can right now, and the benefits of quitting at this time, and then has some quit tips and refers them to our state quit line. And that's something that we posted on social media. We also did this same article in our local newspapers to get people who aren't on social media, and to reach people who aren't on either of those. We did a radio program having a conversation about cessation and how that relates to COVID, as well as getting these handouts to the people in greatest need. So for example, our tribal WIC program, they still have to mail out the vouchers to all the recipients. So we worked with them to insert this education on COVID and smoking into their voucher packets. Or we also worked with the Department of Social Services, who does their renewal packets that they mail out every month. And it went in with those. So just kind of thinking at or through the groups that are in greatest need of this information, that maybe aren't as connected through social media, that would miss it there, and getting it into the hands of the people that truly need that. Also working with elders, like maybe an elderly nutrition program, if they have education they can send out, getting it added to that. And then I think, we've done a lot of social media around just healthy ways to cope, kind of a lot of the things that Josh said, that making that connection too, that if you're feeling like you need to smoke right now and trying to cut back, here's some coping mechanisms to try to that are healthier than turning to that cigarette or vape or chew.
So Rae, before you move on, we have some folks in the chat and comment box asking about the resources and flyers. Would you be willing to share that either with us, or you can kind of...
You bet. I think that the easiest way, and the way I would prefer, is to go to the Chunli Coalition's Facebook page and follow us, and then you'll see this as well as other resources that we might be coming out with in the future. But I will also, following the session, post a JPEG image of this in the comments for people to use and share.
Perfect.
Rae, could you type out Chunli Coalition in the Q&A, just because not everybody knows how to spell that?
Yes, thank you for that reminder, Josh.
And so with the National Native Network, I don't work directly with, the network, we don't work directly with people in our everyday communities. We work more at the program level. So the NNN, we don't offer a quit line, but we do help share information on some of the quit lines, especially some of the tailored American Indian quit lines. And they are still accessible during this time. I don't know of any quit lines that aren't currently operating. That doesn't mean that they aren't, I just don't know of any. So I'm pretty sure that they're all operating. And so, what I just kind of, the tips that I give to people are calling and texting, video chatting with friends or loved ones is a great way to seek support. But there's a wide array of support mechanisms that are available. You can search them out online and look at what you think would be most useful for you. There's apps you can download where you can track your goals and your progress. There's texting programs that check in with you and provide support. There's quit lines that you could call and receive support from a quit coach. Then there's always online support groups that you could find and join in if you're wanting some more intensive social support outside of your friends and family. And I know that there's some So I also started my career working in the substance abuse field, and so I know that there's a couple areas of recovery that are there to support any real major life change people want to make, because it might not be serving them, or addiction can get in the way of a lot of people's lives. So there's all kinds of online recovery support groups and support systems that are available and under disposal. So there's a wide array. And then with the network on our social media pages, we've been sharing a lot of like resources on if people are interested in quitting smoking, they could call 1-800-QUIT-NOW, which is the national hotline, and you'll be diverted to your appropriate state or tailored quit line from there.
We also have another question from Facebook, and I think this one kind of fits perfectly in right now, is how would you share proper information about COVID-19 without triggering people? So I know earlier we talked about, stress and that response that we're kind of all trying to figure out how best to handle within ourselves. I guess, how would you guys address that? I know the both of you share a ton of information. So.
Yeah, I think that even just starting the conversation with, I want to talk to you about your smoking. I don't intend to, cause more stress or anxiety for you, related to this conversation, but I care about you, and I want you to be well during this time, and just approaching it from that aspect, and I'll just be supportive too. I think if accepting, like I said earlier, if they're not ready, if they just say not today, it's just too stressful right now, say, okay, well, I'm here to support you. If you change your mind later, let me know, and then maybe give them a few alternatives to reduce their risks if they continue to smoke during this pandemic.
And the general rule of thumb that I've been trying to use with the network is trying to stay away from like the scare tactics, the shock and awe, or leveraging guilt and shame, but just really sharing information that's pertinent and usable for people. Yeah, I think this is like a side conversation that I think if we have time, I would like to get into later, but there is I'm trying to think of the best way to word this. There's like one academic journal article that's circulating that's, it was a very small study, and it doesn't seem like it was sound science. I haven't read the complete article from beginning to end, but the assertion from this article is saying that people who have nicotine in their system fare better with COVID-19. But again, it was a very small study, and the science doesn't seem very sound. And there's only one article, and there's been many other articles that have shown that outcomes for people who become infected and have complications from COVID-19, it's only exacerbated or only made worse for people who are smokers. So this one study has been passed around social media as like, proof why people should keep smoking. So I want to say that I don't believe that one article. There's been a body of evidence that's been building, even though this is a very new pandemic, and we are learning things new every day. I don't think that this one article is grounds for people to continue smoking or for people to start smoking. So I just wanted to say that, and I'm sure we'll probably touch about it later too.
Yeah, I think that's a perfect segue into our next question. I wanted to talk about the research aspects of COVID-19 and tobacco. So can either of you share what the research really is showing so far? Josh, you mentioned that it's also new, so there might not be a ton of information. But what is that research showing so far about the connection between smoking and COVID-19, and maybe a little bit of how the tobacco industry is interfering with some of that research, if that's happening?
Yeah, I think it's a valid question for whether it's somebody trying to defend their continuation of smoking, or somebody trying to convince somebody not to continue smoking anymore. I think as a respiratory therapist and a nurse, you have to look at the just the anatomy. We know that smoking is bad for the lungs. It causes COPD, emphysema, bronchitis. It can exacerbate asthma. We also know that vaping is bad for the lungs. The new evidence is showing that there's a new disease. It's called EVALI. I believe it stands for e-cigarette vaping assisted. Oh, I don't remember.
I think it's lung injury at the end.
Thank you. Yes, lung injury. So we know that vaping and smoking are hard on the lungs. We also know that COVID is attacking the lungs and the respiratory system. So there's obviously a connection there. The research it's going to take time before we have good, solid research. And of course, one study is a start, but multiple studies can really establish that evidence that there is a connection, and we're not quite there yet. There are some pretty large studies that I've read that the risk of disease progression in people who smoke or previously smoked was nearly double that of non-smokers. And that's in 11,000 patients who had COVID. So we know that there's higher disease progression at this point that's been established in one study. Another study I read said smokers are 1.4 times more likely to have severe symptoms of COVID-19 and 2.4 times more likely to be admitted to an ICU, be on a ventilator, or die compared to non-smokers. So there are some good studies coming out. And as far as vaping, there's less known about that at this point. But I think what we do know is that healthcare workers are being very cautious about anything that generates an aerosol. And such as like a nebulizer might be the most commonly known. If you're familiar with that, it's a machine that people put on their face and they inhale a medication that is like a mist in the air. But the concern is that if a COVID patient is using a nebulizer, that the virus is hanging out in that mist and potentially making it more infectious to other people in the room. So now the question is, how is that really different from vaping and the aerosol that comes out of a vaping pen? And if somebody is using that in your presence, are you going to be more at risk of getting COVID if they have it as well? And I think another study I read said smoking and e-cigarettes increase the risk and severity of respiratory infections due to upper airway damage and poor pulmonary immune function, which we talked about already. It's not yet been tested in SARS-CoV-2, which is the new novel coronavirus we have, but it has been tested in other different versions of the coronavirus. And we know that smoking and e-cigarettes increase the risk of those other infections. So at this point, I think it's fair to presume that the same will be true for SARS-CoV-2 or the COVID-19.
And I don't have as much exhaustive research in front of me, but from everything that I've seen, smoking isn't necessarily good for any of our body systems, especially our immune system during the time of a global pandemic. So I did highlight that one article that I ran into. I actually found it through the World Conference on Tobacco or Health's Facebook page. They were sharing it. And they were like, this is bunk science. And so, what I would say is, especially during a time where people are using social media at rates that they're historic, because it's one of the few ways that we're able to stay connected at this current point in time. So really looking at the things that are coming across your feed and really discerning for yourself what is sound science and what isn't. And really just looking into, and that's not to say that we all need to become armchair scientists, because we don't. There are resources available to us. At the very least, we could visit Snopes and see, because there's fact checkers that work with Snopes. So making sure that you're really critically looking at articles that are coming out and making sure that you're not just blindly sharing them because the headline sounds like something that you're interested in or that you agree with. But really checking out the links before you share them, because sharing disinformation during the time of a global public health crisis isn't helpful. So making sure that you're taking it on yourself to make sure that you're being an informed citizen and that you are not sharing misleading or misleading information or misinformation, making sure that you're being an active global citizen in that way.
And I'll also speak to a little bit about the tobacco industry's role in this. From what I'm reading, more than one big tobacco company, Philip Morris is the one I've seen mostly. They're funding research around COVID and smoking. And I think looking at the funder is important too, because obviously they have their own narrative that they'd like told. And not only does it go to, or related to who's funding the study, but is it peer reviewed? That's something that you can look up if you find the actual study. Peer reviewed means that it's been screened by multiple experts in that journal, and they all agree that it's good, sound science. The tobacco industry has been promoting other non-peer reviewed research that shows that there's not a link between smoking or vaping and COVID, obviously because it fits the narrative that they want told. And they're also promoting the same study that Josh referenced, that nicotine could actually be protective of COVID. So if you've seen those articles or stories out and about, take a good look, like Josh said. I think the other important thing to point out with the tobacco industry right now is not only are they promoting research that isn't sound because it fits what they want people to hear, they're also investing in COVID vaccine. And while that's wonderful, you know, their investment that they're making into COVID vaccine research, as well as I've heard some tobacco companies have donated ventilators to hospitals or donated PPE and hand sanitizer. That's wonderful. I don't want to discourage that, but the amount that they're investing is so much smaller. It's just a fraction of what they're making by selling their product. And if my personal belief is that if the tobacco industry really cared about people and saving lives, they would stop manufacturing tobacco. So I think that when you look at the amount of money that they're making versus what they're investing in this, there's definitely a mismatch, and we have to question the ethics of the tobacco industry in general.
All right, so now we're getting into some of the exciting parts for me as a policy nerd. And so if you guys can tell us a little bit more about what tribal nations and other organizations who are looking to change policies to go commercial tobacco free during the pandemic, how can we really remind those tribal leaders that these commercial tobacco policies are still really important right now if they don't already have one, to really still keep those policy issues at the forefront during COVID-19. So how can we, you know, really share that this is still important?
I think especially, so as I've stated many times, but it's worth repeating, we are in the midst of a global pandemic of a respiratory illness. And so I think that the opportunity for us to be able to translate our concerns into ways and terms that other people will recognize and understand now is probably greater than before. And so I'm not saying that this is an opportunity, because this is not. This is a very sad time, but we have the capability to be able to tailor our message in a way that people will understand, because a lot of people are thinking about our respiratory systems more than they have in recent memory. And so really reminding tribal leaders that there's no way to safely allow smoking in any buildings or on any campus that will still protect the health of the public and the employees. And so I think that that's just a very simple way to really get that across. And then you can get to granular level. So if you're talking about, you know, smoke-free tribal campus for the tribal administration building, right? So ideally, there's going to be reduced traffic in and out of the tribal administration buildings for the time being, even if the tribal administration buildings may not be open at this moment. You know, there's going to be reduced traffic, but still, if you're able to smell smoke when you walk by someone, if they have the illness, there's the potential that you will get it, because if you're smelling the smoke, that smoke likely has left their lungs. So it's a great point, a great possibility of transmission. And also, I think that too, a lot of the way that a lot of us are processing this is we're thinking about ways that we could be infected by others, which is a very important way to think, but also thinking of, if I have this illness, but I'm not showing symptoms right now, because that's what the research is showing, is that you can be, you can transmit the illness without having any symptoms or signs. And so thinking too, what if I have this illness? Would I want to spread this to someone with my secondhand smoke? Right? You know, so thinking of it that way too, because when we talk about Indian country, there's like a larger sense of like sense and community. And so recognizing that I'm one small part of a larger whole, and I have to do my part to help protect my community. And I would say, just looking across at Indian country, there's been a lot of tribal governments that have moved into swift action to protect their communities. And that's to be applauded. So take it one step further and really talk about how exposure to secondhand smoke is concerning, especially during the time of a respiratory pandemic.
Very well said. I don't know if I have too much more to add to that. I think that convincing your decision makers, I think there's a lot of shifts in priorities right now because of COVID. Our tribal leaders and decision makers are so hyper alert to all their COVID-19 response, and it's justified. That needs to be where their attention is. But I think convincing them that smoke-free policy, it should be a part of their COVID response. This isn't just a distraction or something that's unrelated. Like Josh has said, and Chris as well, it's now is the time. If there ever was a time to pass smoke-free policies, this is it. And I think that educating your decision makers on the connection between smoking and secondhand smoke, vaping, and COVID, and the increased risk can help them see the connection there. I am so grateful to be living on a reservation where there's no smoking allowed in any indoor public places. And that's something that I want for people in Indian country throughout the nation. But unfortunately, not many tribes are at that point. So this is a great time to be the advocate for smoke-free air policies.
I agree completely. So there's something in the news that I've been kind of watching a lot lately, and I've seeing more and more about it as different tribal nations and states and everyone else opening up, kind of loosening some of these restrictions on physical distancing and what's closed and what's open. But there has been a lot of news and talk about tribal casinos going commercial tobacco free or smoke free during some of the COVID shutdown. And can you guys kind of share some more information on that? I know, Josh, you guys had a webinar recently on the topic, so I feel like it's a good opportunity to kind of share more about that.
Since we're going back and forth, go for it, Rae.
I will say that I am very pleased to see that there's been a movement to reopen casinos smoke-free. I know that there's been several casinos, tribal casinos now, that have made the decision to reopen smoke-free. Some of them permanently, it sounds like, and others maybe just temporarily. But I think this is a great time for the casino management and the tribes to test it out and see what it's like. I would caution them, though, to they will, I'm sure, have people come and say, well, let's look at the revenue, because that's the big argument about smoke-free casinos, is it's going to hurt the revenue of the casino. But now is not the time to compare revenues. There's not a lot of research on tribal casinos going smoke-free and the impact on the revenue, but there's tons of research on general casinos going smoke-free. And what that shows is that there may be an initial decline in revenue, but in the end, the revenue recovers and they do just as well. I think if your casino in your community is already smoke-free or going to be going smoke-free following this, I would definitely encourage the patrons that go once it reopens to leave comments, because I think that's something that the management takes very seriously. If they enjoy the smoke-free air, make sure they're taking the time to fill out a comment card and dropping it in the box so the management knows that this is something they appreciate. I know here on Shine River, we heard a lot of stories about people who said, I used to not be able, we don't have a casino on Shine River, but we have a bingo hall. And they would say, I've always wanted to get to bingo, but it was just too hard for me to breathe in there because of the smoking. And I'm so happy that I can go to bingo again. And I think the same is true for casinos, that they may lose a few customers, but those that they gain in the process of going smoke-free, and our experience more than outweighs the loss. And ultimately, it shouldn't be about the money. It should be about the health of their community.
Yeah, so I think it was May 15th, I believe, the National Native Network, we hosted a webinar in partnership with the Americans for Non-Smokers' Rights Foundation, Black Hills Center for American Indian Health, and the Southwest Navajo Tobacco Education Prevention Project, talking about tribal casinos reopening 100% smoke-free. So I have included it and I am sharing it here. And I'm also sharing it on Facebook right here. So this way everybody has access to it. And so there was a lot of great information shared on that webinar. And there are some resources. So if you follow that link, there's other resources that are available too on that page. So there's YouTube videos that you could just email to your tribal council members or your casino executives, but I also just really want to circle back and highlight, as I've said before, there is no way that smoking inside of an enclosed space, regardless of size, if you're smoking in a small bedroom versus the size of, a warehouse, it's still a concern, because you'll still have access to, you'll still be exposed to carcinogens, and there's just no way to smoke. And the general guidance for the public is to not use medical grade masks, but to use cloth masks with multiple layers. That's still not going to be enough to filter out all of the particulates that are in the air. So I don't consider myself super sciencey, but one thing that I find really interesting is the filters on cigarettes are there to help create smaller particulates, not necessarily to protect the smoker. The filters in cigarettes have been refined as a science by tobacco industries to increase the key uptake of nicotine and other additives that are part of cigarettes. But that also makes the secondhand smoke finer particles too. And so that's a real concern. And so, if you can smell the smoke, then that means that you're being exposed to a variety of carcinogens and things that are just bad for your health. So even if you go to the casino when if and when they reopen soon, if you can smell the smoke, you're in danger. I just really want to highlight that to people. And it's really easy to be like, oh, well, 5 minutes of exposure is not that big of a deal. But the problem is that the smoke will dissipate. And so the particulates just get taken into the air. I liken it to when you pour Kool-Aid powder into the water. You don't have to mix it. It will mix on its own, right? Slowly. It'll be a lot slower than what you're wanting. But that's how air works too. And that's how smoke works. And so you might not see the smoke anymore, but it'll still be there. And when you leave the casinos, I started my working career bussing tables at a casino buffet. I stink like cigarettes. My uniform just always smelled. My hair smelled. So if you can smell it on you, that means that you have third-hand smoke on you too. So I just really want to highlight that there's no safe way to smoke inside of an enclosed space pre-pandemic, but especially, during a pandemic of a respiratory illness, there's no safe way to smoke inside. There's no safe way to protect not just your patrons, but also your employees. And I guess one other thing that you could use in your conversations with your casino executives or your tribal executives is just really highlighting the healthcare costs. Smokers require a lot more healthcare, both in the short term and in the long term. And so healthcare expenditures for insurance for the employees, for instance, could decrease if you don't allow smoking in the casino. And even not just smokers, people who are exposed to secondhand smoke will need more healthcare throughout their lives, both currently and in the future. So just really looking at those things and really using those to highlight, also it's just not good public health practice generally, but especially during the time of a global respiratory pandemic.
I would just like to add, I think we all love to laugh, and we're at a time when we need laughter even more in our life. So a little bit of a joke, this is not my own, but it's something that we've used and gotten a good reaction from in our community, that having a smoking section in a restaurant or a casino is about the same as having a peeing section in a pool. Mm-hmm. It's a little bit crude, but I mean, if you think about it, it doesn't work to have a peeing section in a pool. It's going to go everywhere eventually. Having a smoking section or a non-smoking section, regardless of how they phrase it, is essentially, the same thing. The smoke is going to go everywhere. It knows no boundaries. It goes under doors. It goes through. Every space will be penetrated by it. And I think the other piece of it is, while casinos are closed down right now, this is a great opportunity for them to do a deep clean. I'm sure they probably are anyway because of COVID, but getting all that third-hand smoke residue off the machines and out of the carpet and the walls and all of that. Why recontaminate it with smoke once they reopen, now that they've done all that work to clean the area and get rid of all the third-hand smoke.
And one other thing I want to add, especially about casinos, is it's and I don't mean to approach any of this from like a judgmental standpoint. I understand. So my area of study wasn't public health. I studied public administration. So I really understand how systems have to work. And I understand having to make difficult decisions, because in an ideal world, we would be able to do it all and protect everybody and make everybody happy, but we don't live in a perfect ideal world. There's always compromises that have to be made. And so I recognize that. But really it's taking a stark look at, our infrastructure within the casinos, or really any tribal building, but especially casinos. So, when you talk about making the investment in the infrastructure of paying X amount of dollars to upgrade and revamp the heating, ventilation, and cooling system, commonly known as HVAC, or putting in new machines for your clientele, typically you're going to choose more machines or new machines because that's going to bring in more money. An HVAC system's not going to bring in more money. But so I say this to say that some of our tribal casinos have been open for 5, 10, 20, 30 years, right? And so some of these are really aged heating, ventilation, and cooling systems. And so when we talk about second and third hand smoke building up, these spaces might not be equipped to be able to handle, secondhand smoke at this current point in time. So those are things to consider too. And so if there's any casino executives on here, I would really suggest that you change your filters and get your ventilation systems cleaned while you're at it.
All right, so we're getting kind of close to the hour. And I had one last thing that I wanted to touch on to make sure that we're touching on this. And it's really around the traditional tobacco, cultural ways. And so how have you guys seen tribal nations responding in regard to different protocols around traditional tobacco growing or harvesting? So we know a lot of folks, sometimes they do this in groups, and so, or it's like a community kind of event. And so how have you seen folks really, responding to that and shifting those practices to really make sure that we're getting traditional tobacco still?
Josh, can I take this one so I can grab my prop to answer that question?
Sure. I don't actually necessarily have a full answer, just because we're just now entering the growing season. I live in northern Michigan, so summer just got here. I know a couple of people have a couple weeks on us, so if you're already planting your traditional tobacco, I'm excited to hear about it. So I don't necessarily have like a full answer, but I do want to say that the summer is going to be a lot different for us. So now is a great time to build your relationship with traditional tobacco. If you, now is a great time to plant some seeds and really get to build a relationship with traditional tobacco, because, we all live busy lives, but we're going to be homebound, it seems, for a while. So now is a great opportunity.
And I'll say the Chumley Coalition, we have a project called Hazel's Chinchasha Project. And basically this is Miss Hazel Redbird. She is, has passed on now, but she was a longtime Chumley Coalition member. And she came to a meeting one time and said, I was asked to do a prayer at a meeting, and somebody handed me a cigarette, and I'm sure we've all seen that happen before. And she wasn't offended, but she accepted it. She offered the prayer, but she said, we have to find a way to turn that into a teaching moment. It's protocol here for Lakota people to not refuse a gift or an offering. So she did accept it, but her idea was to give them our traditional tobacco in exchange. Our traditional tobacco is called chinchasha. It comes from the red willow plant, and it's shaved off of the outer bark here to get the inner bark. So what we have done is to made chinchasha pods, we call them. And basically anybody who is offered a cigarette, we give these out as an educational moment to say, look, here's Hazel's Chinchasha Project. This is what she believed in. And here's some chinchasha that you can use next time you ask for a prayer. And I think the other cool thing with this is just making it more readily available. It's so much easier to just go to the grocery store or wherever your source is and buy a pack of cigarettes, whether it's, Natural American Spirit or whatever your choice is, Bugler, then it's the convenience, that's why they call them convenience stores. But it's so much more work to actually go through the work of harvesting and growing and gathering and all of that. So we're trying to take the convenience of cigarettes and make the chinchasha more convenient for people with Hazel's Chinchasha Project as well. And the one exciting thing that we're doing this year here on the Cheyenne River Reservation is we're going to do our best to propagate some chinchasha just right out back in of our office. We've got some plant experts we're going to lean on for that, because I'm not a plant girl. Anybody that knows me knows I can't keep a plant alive, but we have some help for that, and we're going to do our best to grow it and make it even accessible right in town here.
So we have a question in the chat box, and so it says, and it's from Marion. So I'd appreciate your comments on identifying nicotine in commercial tobacco use as an addiction. On the one hand, identifying it as an addiction and not just a bad habit can help to name the commercial tobacco industry as the cause of the addiction. But on the other hand, addicts are stigmatized and blamed. So what are your guys' thoughts on that?
So I guess what I would say, and so I did start my career working on substance abuse, and I do work with substance abuse still in some of my other roles that I'm engaged with right now. And so those are very fair points, Marion. I think it's also, for a long time, smoking has been talked about as a bad habit, which already has judgmental language built into it, right? But I think that framing it as an addiction can be scary, because most people don't think of smoking as an addiction. Most people just think of smoking as a bad habit, but physiologically is an addiction. There's an addiction level happening within the brain and the hormones and chemical systems of the body. It is. And so the point that you bring up about stigmatizing people who struggle with addiction, it's a very fair point. And I don't necessarily have anything to say other than I think that we should all be working within our communities and within our personal lives to make sure that we are working avidly to destigmatize addiction as a personal or character failing, and just recognizing that people need support in life. And when you don't get that support, you'll typically turn to substances, and nicotine can be one of them. So finding those ways to be like more open and engaging, but also more supportive and more empathetic to other people and to the things that they're going through, and then just helping be a quality support in some people's lives.
Mm-hmm. Yeah, great answer. I think I would only add that I'm a little bit more cautious on using, addict, because I think it's no different than, in healthcare, we don't, or we shouldn't call people a diabetic. They're a person with diabetes. They're a person first, same as asthmatic or any other disease process. They're a person first and the disease a second. So it's the same is true for addiction. They may be a person addicted to commercial tobacco, but I guess I don't like the term addict. However, I think when we're working with youth, using terms like addiction is a lot more eye-opening to them. And I think that from a prevention standpoint, it's important to let kids know that nicotine is addictive and that they need to not make that choice in life. And I just also want to add, this is somewhat related. Some of the tobacco industry, especially this Puff Bar company, is using this COVID time to actually exploit teens and try and get them addicted to nicotine right now. This ad here, it says solo break, and I'll read you the quote. It says, we know that the inside vibes have been quite a challenge. Stay sane with Puff Bar this solo break. We know you'll love it. It's the perfect escape from the back-to-back Zoom calls, parental texts, and WFH or work from home stress. So I think it's pretty clear who their target is here, that when they say parental text, that's generally speaking to youth. So I think now is a prime time to have those conversations with young people in your life and talk to them about not, starting a new addiction while they're stuck at home and maybe looking for a new hobby.
And one thing I do want to chime in, I don't advocate calling people nicotine addicts. You could frame it as tobacco dependence. So like there's alternative language that you can use, and you don't have to like label people as addicts. But I think it's okay to identify it as an addiction, but don't label people as addicts, because that doesn't make anybody feel good. So you could just frame it as like tobacco dependence or nicotine dependence.
All right, so I know we're a little over the time, but in closing, we'd like to ask this question. And so during these times of uncertainty, what words of wisdom do the both of you have that you want to leave us with to support and really encourage our tribal communities?
I think there's so much that could be said to that question, but kind of in because of the topic here at hand, I think just be kind right now. Everybody is going through their own stressors, and we're all probably a little bit on edge or more emotional than usual. So just be kind to others and have respect for whatever the circumstances and situation they're in. We probably don't know their full stories, so accept that we're in this together. And we'll get through this together. I think also being appreciative of all of the people that are on the front lines, as well as our tribal decision makers who are doing their best to protect all of Indian country right now.
And everything that I say just really mirrors Rae. This is a really, really hard time for everybody. And so I'm not saying this to say that, any feelings that you have aren't unique. They're your feelings and they're valid. But just, I would take a breath of caution and just remember that everybody's doing the best they can. Even if someone in your life could be doing better, they're doing the best that they can at this moment. So leaning into that and recognizing that, but also taking the moment to be caring and compassionate to everybody that you come into contact with. If that's the essential workers who are keeping the stores open for us, if that's on Facebook with tribal leaders giving announcements, act with care and compassion. This is really hard times, and it's really difficult to be a decision maker. I don't consider myself a decision maker, but there are people who are, and they're making really difficult decisions, and you might not agree with them, and that's okay. But just really be as compassionate as you can, because they're humans at the end of the day too. But also be kind to yourselves, because it's really easy to get down and get hard on ourselves, because I was going to train for a marathon today and I haven't gone out yet. you know, so I'm not actually planning on training for a marathon, but like being kind to ourselves is really important too.
Right. So I want to thank the both of you, Josh and Rae, for sharing your wisdom with us today, and a really big thanks to everyone else for joining us. So we will post the link with the this discussion, a recording on our website, and you can also find it on Facebook. We hope that all of you will join us for our next COVID and cancer chat, and we'll share the information on that next topic and speakers soon via our social media. So thanks for coming. I'm sorry that we went a little over, but it was good conversation.
Thank you for having us, Josh.
Me,
Take care, everyone.
Gwen.
Thank you. Bye.